Good afternoon, everyone. My name is Angus Murray. I'm the chair of Electronic Frontiers Australia's Policy Committee, and welcome to the third instalment of EFA Talks. This afternoon, we have the privilege of having Dr. Trent Yarwood join us to speak about all things COVID and digital rights. Dr. Yarwood is a medical specialist, a member of the leadership team of FutureWise Australia, an independent NGO that focuses on health, technology, education, and their respective impacts on society. As well as a healthcare policy advocate, Trent has a strong interest in the intersection of health and privacy, including e-health, electronic medical records, and the ethics of public health surveillance. All quite naturally very salient topics and interest areas for the COVID situation, and indeed over the last couple of years in relation to the numerous legislative instruments introduced by our federal government. And that might be a good way to start, Trent. We've recently had the Prime Minister, Scott Morrison, liken the COVID Safe app to sunscreen, with an inference that the app can help prevent COVID-19. Personally, I don't understand that statement as a realistic or plausible statement, but from your perspective, could you explain how COVID Safe could keep Australians safe?
Thanks very much, Angus. Look, I have to agree with you. I think the COVID Safe certainly has the potential to assist our public health response to the novel coronavirus, but giving it the legs to say that it's going to keep people safe by itself, I really think is quite an overreach. So there's lots that we need to do to keep ourselves safe from coronavirus, and the finding out that you've been in contact with someone, I guess, is quite a few steps down the chain. It's a system for notifying you that you may have been in contact with someone who had coronavirus, but that's sort of missing out all of those very important first steps, which are, trying to stay home as much as you can, preventing yourself from being exposed in the first place. It's like the burglar alarm that goes off when your TV's already been stolen. It's you're much better off putting preventive methods in place, and then the burglar alarm can assist the cops getting to your house quicker, or your cameras can help identify who the criminal was. And COVID Safe is like that, in that it can help identify the fact that you may have been exposed. It can flag you to the public health authorities near where you live and allow their job to be easier in terms of following you up. But having the app itself doesn't keep you safe. It's a warning system, if you like.
It seems like an interesting thing to be put, and I think, again, my personal view is it can be somewhat dangerous to sell an application as a preventative measure akin to sunscreen, and then ease restrictions, because that might end up with more people in contact with each other and a greater spread. But I think the global aspect of this, and we were talking about this last week with Lucy from Access Now, is also interesting, and it's important to take it in its full perspective. We do have a number of attendees in this webinar, and as I've done in the past, I'll try and keep these questions to you brief, Trent, and if there are questions from the audience, please use the Q&A function, and I'll put those questions to you as well. But taking that international perspective, there seems to have been a very rapid global uptake of contact tracing applications, specifically in response to this pandemic. Is this kind of technology-driven approach to the spread of disease novel, and has this worked previously?
Look, I think it's important to remember that contact tracing has been around for a very, very long time, and infection, and particularly large infections, have got a long and somewhat inglorious history, and the process of trying to work out where you might have been exposed and who else you might have been exposed has been a manual and pretty labour intensive process for a long time. The public health units have teams of nurses or public health officers whose job it is to respond when there's a case of an unusual infection, something that we don't see very often, like measles, or an imported infection like dengue or something. And once the public health units become aware of that case, then they sort of kick into action and they try and find out where people have been and what they've done, and this sort of fairly complicated manual processing. So contact tracing really is essentially a structured interview where you want to track people's actions and where they've been during the period of time that they were sick, if they're the first patient themselves, so you can find out who may have been exposed. So, for example, I was symptomatic with the measles and I went to see a movie at my local cinema, so that might be a trigger to put out a public health alert saying that people who were in the cinema between these hours should, you know, go and see their GP and consider getting vaccinated. And so I guess it's that part of it that the digital technology has the possibility to assist. Because if I was to say, now's not a good example because we're all staying home because of coronavirus, but imagine 6 months ago, if I had asked you, I'd like you to tell me every single place that you've been for the last week, every single person who you know, who you've been in touch with. You know, a lot of people would struggle with that even on a good day. And you're relying on people's memories of what they've done and where they've been and who they've seen. But of course, you can only rely on the memory of you if you met someone who you actually knew. So if you're in a crowded shopping centre, there's going to be lots of people around there who you don't know, whose details you don't know, who you may have been in contact with for a period of time. And that's really, I guess, the niche that COVID safe and these sort of apps are trying to fill. So it's measuring if you've been exposed enough to another person who might have who subsequently goes on to test positive for coronavirus. But the thing is that there's lots and lots of caveats with that, of course. So it relies on the person who you were exposed to with coronavirus having downloaded the app themselves. It relies on them having installed the app. It relies on them having the app in the foreground on their phone and Bluetooth turned on and their battery not being flat, or them not having left their phone on their bedside table to just duck down to the shops for some milk. You know, that sort of contact is very unlikely to result in coronavirus transmission. But there's lots of potential holes in the system, I guess, and especially when you consider that the app isn't mandatory, so it's still been made voluntary, which is great. But then you're relying on all those sort of contingencies, so that the coronavirus person had the app, it was running, it was installed, you were exposed with them for long enough. You know, it's possible that you can be exposed to coronavirus without what the app would consider to be a significant contact. So, you know, X number of meters for more than 15 minutes. If you're really unlucky and someone sneezes on you at the wrong time, then you could have been doing everything properly with COVID safe and still miss out on that notification. But as we said before, what it does then is it doesn't stop you from getting sick if you've been exposed. It just lets the public health team know that you've potentially been exposed. Your details flow through the app to them eventually, and then they put you on a list to give you a call and do that same traditional contact tracing program that we were talking about. So it supports the work of people in the health department who are doing, you know, what is a difficult job at the best of times, and in settings where they're having to do lots and lots and lots of it. So, you know, I think using technology to assist these sort of processes is really what we should be using these new technologies for. But, you know, it's important that it be done carefully and safely, and that it not be held up as saying, well, this is going to solve all our contact tracing problems, you know, all by itself.
Yeah, I think the messaging that sits around the COVID Safe app from various members of federal government and the manipulative or coercive way in which the app is being pushed on the Australian population, with things like the Health Minister, I believe, Greg Hunt, saying that if you download the app, we can have pubs and sports back, which I think is a very abusive relationship to have as between state and citizen. But from the perspective of data science and the data crunching you've done with health information, personally, I'm a believer that 78% of statistics are made up. And there's an interesting point that's been pushed to us that we need at least 40% of the population to have downloaded and be using the app. On my searching, there have been a couple of Guardian articles recently about this, and you drew my attention to one of these yesterday, that had approximately 5.87 million people having downloaded the app, but there being a difficulty with the interplay between state and federal health authorities and the sharing of information. And then just today, the Victorian health data ended up with one positive case of coronavirus via the app. I can't find the statistics about the use of the app, but can you talk about the efficacy of having a population using an app like this? How far do we have to go before this is actually useful?
Look, you know, obviously the more people who have it, the better it's going to work, because there's a much greater possibility that the person who you come in contact with is going to be using the app. So the more people who use it, the more effective it will be. But balancing that is the fact that we are doing such a good job of controlling the spread of coronavirus with the physical distancing and the restrictions at the moment, that in fact the probability that you're going to come in contact with someone who's got coronavirus is actually very, very low at the moment. And the thing, I guess, that we're always concerned about in medicine is that if you've got a test for a condition, if the condition is very rare, then the test has to perform really, really, really well for it to be particularly useful. So, what that means is if you've got an incredibly uncommon disease and you do a test for it and you get a positive result, the more rare that disease is, the more likely that your positive result will actually be a false positive rather than a true positive. And that it can be a real challenge. And I guess you don't need to think too hard to come up with ways that the app could be a false positive. Someone accidentally smushed the wrong button on their phone. I haven't looked at the app myself, but I'm sure they've got a are you sure, are you really, really sure kind of a feature before you can say that you've been diagnosed as coronavirus. Obviously it's never going to be completely proof against a kid trying to go to the supermarket with his mobile phone and seeing how many people he can possibly prank by pushing the button, after a couple of hours in his local shopping centre. So that sort of thing can always happen. But, what happens once all that data has been sorted is it then is transferred from the feds who have set up the app and who are, I presume are running the data centres for maintaining that data. It is then transferred to the regional public health units, who then have to sort of filter through it. And I understand that there's still that the negotiations on how that data transfer is going to be done are all finalised now. But it's also going to be a new procedure for all those contact tracers. They're going to have all of this data coming out of the app in whatever form it was designed in. And I'm not sure how much time there was for consultation with the states as to what sort of the most useful output data format for these contact tracing lists would be, but then they're going to have this enormous wad of potential contacts from somebody's mobile phone. One of the potential other false positive scenarios that I was talking with one of my colleagues about is he is currently rostered on doing the COVID ward job at the moment for people who are suspected of having coronavirus infection. So if he has his phone in his pocket and he spends more than 15 minutes talking to those patients, is he then a potential contact of every single patient on that ward who's got the app installed? And therefore his name is going to come up like 6 or 7 or 8 times if those people subsequently turn out to be due to coronavirus. So that's why you still need that human factor, because the contact tracers will then have to say, well, this contact has come up lots of times and, we've given him a call and found out that he's actually an infection specialist. So therefore, we'll just cross all those off. So there's still going to be lots of filtering that's required, and really the need for a good, experienced hand of people who know what contact tracing is all about.
It's interesting. It's one of those difficult situations where I have been very critical of federal and state governments introducing legislation very quickly and then passing it on an almost immediate basis following its introduction with very little consultation and very little scrutiny. This is a somewhat unique situation because I can see the public health and public policy justification for moving very quickly with respect to the legislative framework around this. Although, to my knowledge, the privacy impact assessment, which wasn't going to be produced, but did end up being produced, was produced at the same time as the legislation was passed, yes. I believe, which kind of makes it a redundant exercise if it's a foregone conclusion that irrespective of the impact assessment, the legislation will pass. But again, going back maybe to the messaging point, because I think that's a quite important aspect of this and its operation. There's obviously a lot of fear around COVID-19. It's caused global panic in relation to contraction of the virus. We've seen restrictions not only domestically but internationally, travel and movement, as well as people completely reshaping their lives with a new normal being created in 2020. With that fear, there seems to have been a polarization in the same way as the anti-vaxxer movement. Is a pandemic something that can be prevented by this kind of surveillance technology? Is that the anti-vaxxer rationale of this that if you're not downloading the app, you're hurting other people, justified? And then as a probably more detailed follow-on question to that, if technology isn't the whole solution, there's a human element to this as well. Where should the money and focus be being spent and applied during a pandemic?
So, as I said before, I guess, you know, as someone who works in infection, I'm aware that infection has a pretty bad reputation. You know, you say to people, oh, actually, I'm an infection doctor, and they all sort of step back and sort of put their hands in their pockets and, you know, get lots of, oh, I hope you wash your hands lots. So, you know, there's a whole heap of, there's been a lot of research in how people perceive risk, and there are many factors that come into play in a pandemic that elevate people's perception of risk, you know, much greater even than what the actual risk might be. That is, that it's something foreign to them, you know, not something that they understand very well, something that's seen as not having any agency. So, for example, if you you know, if a heavy object falls on you and crushes you and break your leg, that's kind of seen as more unfair than if you're in a car accident, you break your leg because you were driving the car. So, you know, you don't have any agency over the virus wafting into your immune system and making you sick. So there's all these factors that pandemics particularly, and infection more generally, bring out. And you know, the original Latin root for the word pestilence comes from the word meaning unwholesome. So there's been this sort of hangover of disease being something that happens to people who aren't clean enough, or, you know, all that sort of stuff. And all of these psychological and sort of social factors really play into amplifying people's fear about it. And so, you know, one of the things that happens when people are scared and anxious is that they want information. And, you know, I think the challenge that our governments sort of very strongly all experienced in the early days of the pandemic is that there wasn't a lot of information. It was a rapidly changing situation. It was happening overseas in China, and the information may not have been flowing out very well. So there wasn't a lot of information to give. And the trouble is, when people don't have enough access to good, reliable information that they trust, then they go searching for any other information that they can find. And, you know, the anti-vaccine example is I guess one of the best examples of there's lots of nonsense on the internet, and if you search using the wrong keywords, you'll find nonsense instead of good, you know, useful information. And so it was this real challenge where the information wasn't very available. It was changing very rapidly. You know, I think we'd all probably agree that the government, particularly in the early stages of the pandemic, didn't do a fabulous job of messaging it. You know, thinking of Scott Morrison's "I'm still going to go to the footy on the weekend" teleconference, you know, video conference in particular. And then that information vacuum, if you like, creates this space where people go and just make up their own nonsense. And, you know, it's as a doctor and a scientist, one of the things that's been fantastic has been just how rapidly the scientific information has been shared. But, you know, it's kind of what we've seen in the scientific publishing is that everybody's been in such a hurry to get the information about this new coronavirus out so quickly that there've been some, not shortcuts taken, I guess, but things haven't undergone the same sort of slow, careful, rigorous process of peer review that we normally used to in the scientific literature. You know, coming back to what we were talking about the other night, it's kind of like, it's almost sort of fail fast, fail often, but applied to medicine. And so there's been articles that were published that had a slightly controversial or different take that then managed to get shared widely because of the internet, that then subsequently got retracted. But everybody's heard about the article, but many, you know, a lot fewer people have heard that article that actually said that the coronavirus did X, Y, Z got retracted. And so you still find people even now sharing those sort of theories, like, you know, it was a Chinese lab bioweapon or any of that sort of nonsense that, you know, is clearly not true, but someone who had a PhD in something suggested it once, and then it got shared widely on the internet, and so crawled its way up Google because lots of people were sharing it. So I think it's you know, it's a real struggle, and it's very much a two-edged sword that you know, increasing people's ability to access information is good when the information is good and reliable, and you can steer people in those sort of directions, but also has a downside where, you know, there can be a lot of nonsense spread very easily as well.
Yeah, and I think that's the very double-edged sword of the internet and the interconnected world that we live in now. We do have the access to information, and the information that we have access to is very useful until there's too much information or misinformation, and it becomes very unuseful or unhelpful. Taking a question from our audience and tying that into the conversation we're having, and one of the earlier questions I've asked you, Trent, there's a global approach being taken here, and there's a lot of examples internationally of this kind of contact tracing occurring. The commonality in that is private enterprise or large multinational corporates developing these applications for governments. We've seen that in Australia with AWS being the base for the COVID safe application, and there's been criticism about, although the data is remaining in Australia, the company that's providing the solution is American based. And there are other examples, like I believe our contact tracing application, COVID Safe, was based on the Singaporean application. There are also contact tracing applications being developed in Taiwan, China, and they may be applied in slightly different ways. Is there anything we can learn from other countries that are developing this kind of technology or applying this kind of technology? And is there any commentary you have about risks or benefits that we're seeing internationally?
Yeah, look, as I said before, I think one of the things that has been really excellent out of coronavirus has been the willingness for much more rapid sharing of global science and some of these developments. And it's excellent that the Australian government didn't have to build, that once they made the decision to make the app, that they didn't have to then go and contract people to build it from scratch, that they were able to access experience from overseas. But, I think it's difficult to draw lots of parallels from overseas just because of the really different, social structures. There's a lot more acceptance of, a greater level of social control in places like Singapore. There is a lot more social control without necessarily the same acceptance of it in China, and in other parts of the world, then they have much more robust frameworks for protecting human rights than we do in Australia. So, I think it's difficult to exactly draw lots of parallels from overseas. So, I don't think anyone would argue that we would want to have the same sort of omnivalence that they do in China, for example, even if the trade-off was going to be better health. But I think we need to take what we can learn from overseas and try and make it work for the Australian situation. And I think as we were sort of just chatting about before, one of the real issues is that there's we're at a very, very low point in terms of the ebb of trust in the government, with things like robo-debt and census fail. And then for our government to come out and say, hey, that's all right, we're going to fix it this time with an app, it's going to stretch people's credulity a lot more than it would where in other places where they've had a much more successful history of implementing big IT programs like this.
Yeah, I think that not drawing a parallel with other countries is actually probably a really good way of framing that, and I very much appreciate that concept, Trent. In terms of your work in health surveillance and maybe taking that parallel, I heard yesterday an interesting term for the COVID Safe app, or the kind of contact tracing technology, as a spin on Jeremy Bentham's panopticon, that it's the COVID opticon, being the all-seeing eye of government, and a way that people don't, the panopticon being circular vision in a prison where guards can be watching any prisoner at any point in time, and therefore prisoners would be better behaved. It's an interesting comparison to make because it is a form of surveillance technology, and as you said, there are different social structures around the world where people are more willing or less willing to be controlled in a social environment or monitored by a government. And Australia, as you said, lacks the federal enforceable framework for human rights that many other countries have, and the norms that underpin those human rights. Is this the start of a slippery slope where the next flu season will end up with people being contact traced and monitored Is this something where we've started ourselves down a path that's likely to end in some form of dystopia?
Look, I think, I guess I'll approach that in a couple of parts. So the first one is, I guess approaching that from that sort of the panopticon, the Benthamesque model. So we're very familiar with that in medicine, particularly in like hospital quality and safety. So there's something that originally actually came out of like industry, manufacturing, that's called the Hawthorne Effect, which is people change their behaviour when they're being watched. And so in terms of factory floor workers, they're more productive when the supervisor's standing there with a clipboard because they know they're being watched and they just have to do things that little bit faster. In hospitals, where we see that most commonly is in when we do surveillance of whether staff are washing their hands as frequently as they should be in the hospital. And we know that when you're walking around with your iPad or your clipboard or whatever it is doing your hand hygiene audits, that the rates are always much better than they are actually in the real world. So, being surveilled does change behaviour, absolutely. And will people, I don't know that it would be significant enough to actually have a measurable public health benefit, but maybe if people do install the app, then it will encourage them to stay home, which, is really the most important thing that we can do. The method by which we're going to beat coronavirus is people staying at home, not going to work when they're sick, washing their hands, all of those simple things. And so that the app sort of, its stated goal is to help clean up the mess if those things don't work, but maybe it will have a bit of a, what the public health people call a nudge type intervention on people's behaviour by installing it. In terms of other, surveillance of infections, look, I think, we already do quite a bit of infection surveillance via lots of different means. So, when people have a flu swab, then that gets counted and recorded, and that's how we can tell, whether it's going to be a big flu season or not. And, by doing extra testing on that lets us work out what the best strains to put in next year's flu vaccine are going to be, hopefully. So, it's not to say that there's absolutely no role for disease surveillance and that, it's only downsides in terms of impacting people's privacy. A lot of health planning relies on having this sort of understanding of disease patterns that comes from measuring things. And so, I certainly wouldn't want people to think that I'm saying that, no, we shouldn't be doing any sort of disease surveillance at all. But I guess the thing that, the thing that I think is interesting in the government's approach to COVID safe is that, as you said, there were certainly some issues with it being done quickly and the privacy impact statement coming out sort of, simultaneously with the legislation. But, to give the government a gong where they maybe deserve it is that the privacy constraints in the legislation for COVID safe are, very, very substantially better than, for example, the privacy constraints about my health record. And, if you think about it, it really should be the other way around, because the app has been designed so it's an anonymised 3-week only measurement of people who you've been in 2 meters of for more than 15 minutes. At the end of the day, there are obviously privacy concerns about that sort of stuff, but it's not the same level of health information as every single bit of your medical history that was in that letter that your GP wrote to your specialist and then uploaded to my health record, that is then accessible to any law enforcement agency or about, one of about 30 different para sort of government organisations to get access to without a warrant. Very, very different sort of quantum of health privacy concern about the surveillance associated with COVID safe and all of the rest of our digital health information, but there's very, very, very different standards applied to the privacy around them.
I think that's a really important and really interesting point. The government is capable of using pro-privacy language in legislation, and it isn't something that's impossible, which I think is one of the great positives, and I share that gone. The government can articulate fundamental human rights and the protection thereof in legislation. And it's interesting, as you said, the contact tracing app, which inherently and by design should be more pro-privacy than my health record, and certainly more pro-privacy and something like the assistance and access legislation, or the issues around mandatory metadata retention, which lack that language.
Absolutely.
Which is a great positive to take, because hopefully that sets the start of a positive precedent for government that we can articulate our rights in legislation, and that there is a proper basis to do so, and that it isn't just something where it's a foregone conclusion that government will look after us. There is a legislative framework that can exist and now does exist that is pro-privacy, or at least in its language is pro-privacy. Trent, I've made a commitment in these EFA talks not to take too long and not to exceed 45 minutes in the presentation, and I could continue to talk about COVID safe, and if we start descending into the interaction between the assistance and access legislation and the COVID safe tracing application, I'm sure we could have a very heated discussion about
I'm sure.
How that interplays. But I wanted to take that sentiment that we were just talking on in terms of where this is useful and where this goes in the future. And I've asked this question in previous iterations of EFA talks, but I think for you, framing this specifically in the context of health data and health information, as a very brief final point to make in this discussion, if we could cast ourselves into the future, and we're sitting now in 2050 having this discussion, reflecting on what happened in 2020, what advice would you give from that position in 2050 to today?
So I think specifically from the point of view of infection, I think it's really important to remember that this will happen again. You know, this will not be the last pandemic that we'll see. Hope we may not see another one this big until 2050, but it's not a matter of if it happens again, it will happen again. And so we really need to take what we've learnt from coronavirus, just as we did from swine flu in 2009, just as we did from SARS in 2002, just as they did from the 1918 flu, you know, as much as they were able to back then. So, you know, the things that are going to keep us safe aren't, you know, in my job in infection prevention is actually pretty simple. Wash your hands, don't come to work when you're sick, you know, keep your distance if you're unwell. That's basically it, my job in a nutshell, and that's not going to change between now and 2050. You know, the technological tools that we use to get people to do that may look a little bit different, but at the end of the day, washing your hands is going to save a hell of a lot more lives than any new technology between now and then ever will. So, you know, it's really important to remember that the app is a supplement to the human factors, not a replacement for them. And if we all continue to do the right stuff, then that's going to give us the best chance of getting through this now and sitting around in 2050 to look back on it. I guess the second thing is that I would be very surprised by 2050 if we don't have, you know, a much more digitalized health system than we do now. And, you know, I really hope that I can say in 2050 that as you say, the government has been able to take the things that they've done really well out of COVID safe and apply those same sort of privacy principles to all the rest of, you know, what we will do with our health information electronically in 30 years' time.
I think that's a really good sentiment, and it's, I think, always interesting when we can throw ourselves back into the past when answering something for the future. And soap, which is something that we've had for quite some time, and the ability to destroy fatty acids or lipids around viruses is probably actually the best way of dealing with the situation. All of the technology is just ancillary or supportive of that, which I think is a message that government could take rather than the bargaining chips that they're attempting to put on the table with respect to downloading the app. But Trent, on behalf of Electronic Frontiers Australia, thank you very much for coming and talking to us. Thank you to the audience and the questions that we've had posed during the session. It's great to have the involvement of people into these discussions, and I think it's important for us to have a broader discussion about the issues around digital rights rather than just staying digital rights centric, because digital rights affect every aspect of our society and every aspect of our interactions. And finally, a big thank you to Robin Doherty and his team at ThoughtWorks for providing the platform for us to have EFA Talks and the ongoing support. I'll end it there, but look forward to seeing you all in 2 weeks' time for the next iteration of EFA Talks. And thank you, Dr. Yarwood.
Thanks very much, Angus. Thanks, Robin. My pleasure.